A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Good afternoon, dear student. Today we will discuss about appendicitis. So, what is appendicitis? What disease is this? And what is the symptoms of this? And how we can remove this through surgery? So, now we are coming to our discussion. Appendicitis is an inflammation of the appendix, a finger-shaped pouch that projects from your colon on the lower right side of your abdomen. The appendix doesn't seem to have a specific purpose. Appendicitis causes pain in your lower right abdomen. However, in most people, pain begins around the navel and then moves as an inflammation. Worsen appendicitis pain typically increase and eventually becomes severe. Although anyone can develop appendicitis, most often it occurs in people between the age of 10 and 30 years. In what age appendicitis may occur in a person? So, mostly appendicitis occur at the age of 10 and 30. Standard treatment is a surgical removal of the appendix. Now we are coming to the symptoms of the appendicitis disease. So, signs and symptoms of the appendicitis may include sudden pain that begin on the right side of the lower abdomen. So, where the appendicitis pain may occur, so it may occur to the right side, lower at the abdomen. Sudden pain that begin around your navel and often shed to your lower right abdomen. Pain that worsen if you cough, walk, or make other jarring movement. Nausea and vomiting. Do you know vomiting and nausea? What is vomiting and nausea? Loss of appetite, low grade fever that may worsen as an illness progresses, constipation or diarrhea, abdominal bloating. The site of your pain may vary depending on your age and the position of your appendix. When you are pregnant, the pain may seem to come from your upper abdomen because your appendix is higher during pregnancy. When to see a doctor? Make an appointment with a doctor if you or your child has some sign and or symptoms. Severe abdominal pain require immediate medical attention. Causes of the appendicitis are a blockage in the lining of the appendix that result in infection is the likely cause of appendicitis. The bacteria multiply rapidly, causing the appendix to become inflamed, swollen, and filled with pus. If not treated promptly, the appendix can rupture. So now we are coming to discuss with you the complication that can come in during appendicitis. So appendicitis can cause serious complications such as a ruptured appendix, a rupture spread infection throughout your abdomen, peritonitis, possibly life-threatening. The condition requires immediate surgery to remove the appendix and clean your abdominal cavity. A pocket of pus that form in the abdomen. If your appendix bursts, you may develop a pocket of infection, abscesses. In most cases, a surgeon drained the abscesses by placing a tube through your abdominal wall into the abscesses. The tube is left in place for 2 weeks and you are given antibiotics to clear the infection. Once the infection is clear, you will have surgery to remove the appendix. In some cases, the abscess is drained and the appendix is removed immediately. So now we are coming to the diagnosis of the appendicitis. So to help diagnose appendicitis, your doctor will likely take a history of your signs and symptoms and examine your abdomen. Tests and procedures used to diagnose appendicitis include physical exam to assess your pain. Your doctor may apply gentle pressure on the painful area. When the pressure is suddenly released, appendicitis pain will often feel worse, signaling that the adjacent peritoneum is inflamed. Your doctor also may look for abdominal rigidity and a tendency for you to stiffen your abdominal muscle in response to pressure over the inflamed appendix guarding. Your doctor may use a lubricated gloved finger to examine your lower rectum. Digital rectum exam. Women of the childbearing age may be given a pelvic exam to check for possibly gynecological problem that could be causing the pain. Blood test is the main diagnosed during appendicitis. This allows your doctor to check for a high white blood cell count, which may indicate an infection. Second come urine test. Your doctor may want you to have a urinalysis to make sure that the urinary tract infection or a kidney stone isn't causing your pain. Imaging test. Your doctor may also recommend it an abdominal X-ray, an abdominal ultrasound, or computerized tomography CT scan to help confirm appendicitis to find other causes for your pain. Treatment of the appendicitis or appendicitis treatment usually involves surgery to remove the inflamed appendix. Before surgery, you may be given a dose of antibiotics to prevent infection. So, what is the main treatment of appendicitis? So, the main treatment of appendicitis is surgery. What is surgery to remove the appendix? Appendectomy. Appendectomy can be performed as open surgery using one abdominal incision about 2 to 4 inches, 5 to 10 centimeter long. Laparotomy, or the surgery can be done through a few small abdominal incision. Laparoscopic surgery. During a laparoscopic appendectomy, the surgeon inserts special surgical tool and a video camera into your abdomen to remove your appendix. In general, laparoscopic surgery allows you to recover faster and heal with less pain and scarring. It may be better for people who are elderly or obese, but laparoscopic surgery isn't appropriate for everyone. If your appendix has rupture and infection has spread beyond the appendix, or you have an abscess, you may need to open appendectomy, which allow your surgeon to clean the abdominal cavity. Expect to spend 1 or 2 days in the hospital of your appendectomy. So, surgery of the appendicitis can be done by 2 ways. And first tip come open surgery, and second through a video camera and appendectomy. A surgeon can insert a video camera to your abdomen and done surgery through it. So now we are coming to discuss with you draining an abscess before appendix surgery. If your appendix has burst and an abscess has formed around it, the abscess may be drained by placing a tube through your skin into the abscess. Appendectomy can be performed several weeks later after controlling infection. Thank you, dear ladies and gentlemen, for giving time to me. If you like, please subscribe and share with others. And if you do not like my procedure of teaching, please put your and discuss your suggestion in the comments. So next video we will continue on your suggestion. Thank you, dear ladies and gentlemen.